Polypharmacy, seniors taking 5 or more prescriptions each day, has become a common reality for older adults. But what if fasting, when done safely and with medical guidance, could help bring that number down? Clinicians like Dr. Alan Goldhamer report strong results in supervised settings, showing that seniors who follow structured fasting protocols often see improvements in blood sugar, reductions in metabolic decline, and a reduced need for daily medication. The goal isn't only to add years to life, it's to improve the quality of those years. Later, I'll share a practical starting plan and the key safety checks every senior should discuss with their doctor. And since today's seniors are managing more prescriptions than any generation before them, it raises an important question about whether all of those drugs are truly necessary. Why fasting matters for seniors in 2025. In 2025, the conversation around health for older adults is shifting in a very specific way toward the question of fasting. For decades, seniors have been told that the key to long-term health is tightly managed medication schedules. But now, more researchers and clinicians are drawing attention to fasting as a practice that may reduce dependence on drugs and target the very issues that cause chronic disease in the first place. What makes fasting matter so much to seniors right now is not that it's new, but that its benefits appear to strike at the challenges aging adults face most directly: high blood pressure, insulin resistance, low energy, and the gradual accumulation of pills that rarely solve those core problems. Much of the hesitation around fasting for seniors comes from the belief that it's unsafe in older age. The concern makes sense. Many older adults naturally lose muscle mass and sometimes struggle with weight loss already. On the surface, withholding food might sound like adding fuel to the fire, but clinical work has increasingly challenged that assumption. Under supervision, fasting can support older adults by reducing the very symptoms they are medicated for in the first place. Blood pressure, glucose management, inflammatory markers, and even early signs of cognitive decline all show measurable improvement during structured fasting programs. Seniors in these settings are not wasting away, they're experiencing changes that make daily functioning easier. Importantly, fasting isn't simply another way to count calories. When you stop eating for set periods, the body shifts into a restorative mode that constant eating never allows. Repair pathways like autophagy switch on, damaged proteins are broken down and recycled, and the body shifts toward using fat as a primary energy source. This combination reduces inflammation, improves metabolic control, and resets hormone rhythms tied to energy and sleep. For an older adult, it means more than cutting energy intake. It signals a fundamental recalibration of how the body runs. A practical example makes this clearer. Imagine someone who has struggled with elevated blood pressure for years. Medication adjustments gradually increase. Side effects build over time, yet the root issue stays in place. When this same individual undertakes a carefully supervised fast, the response is often striking. Blood pressure can fall significantly within days, and for some patients it stays at safer levels long after refeeding begins. In certain cases, medication doses have been lowered or discontinued altogether. To be clear, results differ from person to person, and they depend on the fasting duration, medical oversight, and the individual's overall health. But the potential for rapid improvement is real and documented. This is also where the limitations come into play. Clinical reviews consistently point out that while fasting demonstrates powerful benefits in markers like blood pressure, insulin sensitivity, and chronic inflammation, large randomized studies in people over 65 remain limited. Older adults bring unique risks, comorbidities, variable nutritional status, and differing medication burdens that require careful consideration. This means fasting should be approached not as a blanket prescription, but as a tool that needs medical guidance and individualized planning. Even with those caveats, the consistent observation is that when it's done properly, older adults can experience meaningful health improvements that lighten their pill load rather than add to it. And those improvements aren't vague. The most widely reported results in supervised fasting settings include lower blood pressure, improved insulin sensitivity, and measurable drops in systemic inflammation. For many seniors, these shifts translate into reduced fatigue, steadier daily energy, and less dependence on drugs with irritating side effects. In other words, fasting produces the very health changes that daily prescriptions aim for, but by addressing the core dysfunction instead of masking its outcomes. This distinction between management and reversal is essential. The majority of common prescriptions are designed for control rather than lasting correction. Blood sugar can be lowered by medication, but the cellular resistance to insulin remains. Cholesterol can be reduced with a pill, but the metabolic processes behind it remain uncorrected. Fasting actually prompts the body to recalibrate those processes, lowering stored glucose, reducing pro-inflammatory load, easing burden on the kidneys and liver, and supporting healthier cardiovascular function. For someone who has spent years feeling stuck inside a cycle of measurement and dosage, that shift from controlled numbers to underlying repair can be life-changing. Adding to this perspective is the understanding that not every health condition of older age is inevitable. Issues like hypertension, type 2 diabetes, and chronic inflammation are not simply the result of birthdays. They develop after long-term metabolic imbalance combined with environmental and lifestyle pressures, which means interventions that recalibrate metabolism, like fasting, can improve or even reverse them. For seniors, this is not about avoiding aging altogether, but about separating what is truly age-related from what is accumulated dysfunction. That difference is crucial, and fasting directly addresses it. Of course, skepticism remains. Many assume seniors are too fragile to engage in fasting safely. But clinicians experienced with older populations counter this by showing the opposite under appropriate guidance. What proves more damaging for older adults is not the fasting itself, but the years of multi-drug use, polypharmacy, that place immense cumulative strain on the liver, kidneys, and digestive systems. To borrow a mechanical analogy, fasting doesn't starve the engine of fuel. It clears the sludge and allows the parts to function properly without constant chemical manipulation. On a very practical level, this has substantial implications. A single additional prescription often cascades into side effects that require yet another medication. What begins as treatment for elevated blood pressure unfolds into a sequence of dependencies that burdens daily life. Fatigue, dizziness, electrolyte loss, and sleep disruptions layer over each other until the drug regimen begins to feel heavier than the conditions themselves. Fasting, by reducing the need for some of those initial prescriptions, interrupts that cascade before it becomes unmanageable. It's worth remembering that fasting is not some breakthrough discovery of the modern world. Humans have practiced it for centuries, whether deliberately for health or simply because food was not always available. What's new is the modern lifestyle, which eliminates natural gaps in eating and piles medications on top of the body's load. Seniors today are living in an environment of near constant consumption and pharmacological support. Fasting reintroduces a habit that biology already recognizes, giving systems the time and space to restore balance rather than endlessly compensating. And this is why fasting holds such unique relevance for seniors in 2025. More than ever, life expectancy has expanded, while the years lived in compromised health have also stretched longer. The real opportunity is not simply extending lifespan, but reducing the burden of chronic conditions that imprison people in cycles of treatment. For older adults, fasting represents a grounded, practical method of not only slowing decline, but in some cases reversing it. Understanding this puts the next issue into sharper context. Around the world, seniors are not just contending with chronic illness, they're managing entire stacks of daily prescriptions, often multiple times a day. It's here, in the growing complexity of those routines, that the true weight of modern aging becomes most visible: the prescription pile problem. Many older adults today face what doctors call the prescription pile problem. Polypharmacy, taking 5 or more medications at a time, has become common among seniors. For many, daily life is organized around pill boxes divided by the hour, with drugs for blood pressure, cholesterol, sleep, digestion, blood sugar, and pain all lined up. It looks like careful management on the surface, but the reality is that these stacks of pills often create as many difficulties as they try to prevent. The problem isn't just the quantity. It's how one drug leads to another. A blood pressure medication can cause dizziness. That dizziness increases fall risk, which may require pain medication after an injury. Pain medication, in turn, can cause constipation, sparking the addition of a laxative. A treatment designed to help the heart ends up reshaping life in ways that no one planned. This isn't an unusual story. It's the pattern at the center of polypharmacy. Research shows that polypharmacy doesn't just create inconvenience, it heightens risk. Older adults are more vulnerable to drug interactions because their liver and kidney function often decline with age. Medications that would be tolerable for a 40-year-old can accumulate in the system of someone in their 70s, intensifying side effects and making standard doses too strong. The result is sometimes extreme fatigue, confusion, or even dangerous medical events. In fact, polypharmacy increases the likelihood of adverse drug reactions and hospitalizations, with many seniors ending up in emergency rooms not because of their original condition, but because of medication conflicts. On a day-to-day level, this takes a heavy toll. Instead of feeling energized, many older adults live in a fog of side effects. Fatigue, digestive discomfort, weight changes, and mental cloudiness become accepted as normal aging when they might actually be consequences of drug combinations. And because specialists often prescribe medications without full visibility into the others a patient uses, even well-meaning decisions can create complicated overlaps. What looks like healthcare progress can quietly become a cycle of managing medication side effects rather than treating disease itself. For a lot of seniors, the pill organizer symbolizes this burden. The brightly colored compartments, meant to bring order, serve as a reminder of just how many moving parts there are to get through a single day. And, unlike misplacing a set of keys or a grandchild's phone, missing or doubling up on a pill can have a serious impact. Mistakes happen often, especially when prescriptions multiply faster than anyone can fully keep track. This is why the prescription pile weighs so heavily, not just physically but mentally. Living with multiple medications can make someone feel less like a person and more like a patient defined by conditions to be managed. Each new prescription signals another layer of dependency. And while some drugs are essential and life-saving, it's clear the system often defaults to adding rather than asking whether there might be a way to subtract. That's where fasting offers a different pathway. Instead of addressing symptoms with yet another pill, fasting works on the deeper processes that made those symptoms emerge. Blood pressure, for example, has been shown in supervised fasting programs to decrease significantly, reducing or eliminating the need for medication. Blood sugar regulation often improves, meaning some patients with type 2 diabetes require less support from drugs. And when inflammation lowers, pain tends to ease, which can lower reliance on painkillers and all the secondary medications they necessitate. The difference is this: rather than patching problems one at a time, fasting shifts the entire baseline of health. It is not an overnight cure, and it is not safe for everyone without oversight, but the documented results show that for many older adults, medication lists do shrink. The domino effect begins to reverse. Fewer prescriptions leading to fewer side effects, leading to fewer follow-up medications. It's important to recognize balance here. No responsible physician would suggest that every drug can or should be thrown away. Some conditions absolutely require long-term pharmaceutical support. But by easing the metabolic dysfunction that drives so many prescriptions, fasting creates opportunities to reduce dependency. A senior moving from 8 or 9 daily pills down to 3 or 4 isn't just experiencing a smaller regimen, it's regaining a sense of freedom. This freedom extends beyond the body. There's a psychological lift in no longer feeling tethered to medication schedules that divide the day into strict intervals. That shift restores dignity and builds confidence. People see themselves less as patients and more as full participants in daily life. They move through days with more energy, fewer restrictions, and without the looming worry of managing side effects from a complex mix of prescriptions. The benefits ripple outward to families and the healthcare system as well. Fewer prescriptions often mean fewer emergency room visits, fewer hospital stays due to drug interactions, and decreased financial strain from extensive pharmacy bills. Families worry less about whether mom or dad is keeping the schedule exactly right, and seniors themselves can focus less on medical logistics and more on meaningful activities. Taken together, this picture is clear. The prescription pile is not an inevitable part of aging. It reflects a default to management by addition, layering drug upon drug in the hope of control. Fasting approaches it differently by addressing the metabolic roots of disease and restoring stability without adding to the chemical load. Later in this video, we'll go into exactly how seniors can approach fasting in a way that reduces medication needs safely, along with the precautions required to prevent risky interactions. For now, the key point is this: the cycle of adding prescription after prescription isn't the only option, and there is a way forward that doesn't depend on constant pharmaceutical expansion. And that brings us directly to the next misconception many seniors have lived with for a lifetime: the idea that you must never skip a meal or you'll get weak. Fasting versus eating regularly myth. For decades, nutrition advice emphasized steady eating patterns, but one of the most persistent messages was the belief that eating regularly prevents weakness. Older adults in particular were cautioned that skipping meals might leave them vulnerable to sudden drops in energy or blood sugar. The assumption was that frequent eating was the safest way to stay fueled, but research now paints a more nuanced picture. For many people, short fasting windows do not cause weakness. Metabolism is equipped to shift from glucose to stored fat and ketones, which can provide steady energy. At the same time, it's important to acknowledge that those on medications affecting blood sugar or blood pressure need medical supervision before making changes to eating patterns. Understanding how this works begins with energy storage. Normally, the body uses glucose from food as its main fuel. When meals are spaced out, the body transitions, first drawing on glycogen in the liver and muscles, then shifting toward producing ketones from fat stores. This change usually occurs somewhere in the 12 to 24-hour range, though the timing varies. Ketones are a reliable alternate energy source and are frequently described as supporting clearer thinking and more stable physical energy. In this way, fasting often feels less like deprivation and more like switching power modes. Why does this matter so much for seniors? As the body ages, processing sugar and starches often becomes less efficient. Frequent eating can extend blood sugar spikes throughout the day, pushing the pancreas to release insulin repeatedly. Over time, this can create or worsen insulin resistance, which leaves people feeling sluggish after meals and more fatigued overall. Brief fasting intervals interrupt this pattern. By reducing the number of daily spikes, insulin levels can stabilize, and cells may gradually respond to insulin more effectively again. Many older adults describe experiencing steadier energy once they establish a consistent fasting routine. One easy comparison is the hybrid car. When one fuel source runs low, the system transitions seamlessly to another. Human metabolism works the same way. When glycogen stores decline, fat takes on the role. This isn't evidence of starvation. It's normal physiology that developed long before the modern culture of constant snacking. The problem is that decades of eating every few hours have kept many seniors locked into one mode, leaving their bodies out of practice at switching fuels. Fasting reintroduces that capacity, allowing people to discover that they can go longer without food than they may have thought possible, often with less fatigue, not more. Critics sometimes argue that fasting places older adults at risk of losing muscle. Here again, the details matter. Short fasts and intermittent fasting schedules generally preserve lean mass when paired with adequate protein intake and light resistance activity. In fact, the hormonal shifts during fasting often support tissue maintenance. What really protects seniors' strength is consistent protein in meals and simple strength work like resistance bands, walking with light weights, or chair exercises. The point is not that fasting eliminates all concern about muscle, but that with a balanced approach, it can work alongside practices that support lean tissue rather than erode it. For those who try fasting under safe conditions, the reported effects are often the opposite of weakness. Blood sugar steadies between meals, digestion gets a break, and energy doesn't dip as sharply after eating. Some seniors even report fewer issues with bloating or heartburn because long pauses between meals reduce gut strain. That sensation of balance, steady rather than spiking, is the outcome people often find most surprising. Instead of feeling frail between meals, many feel noticeably more resilient. The role of ketones is especially important here. They not only provide fuel, but they do so in a way that often benefits the brain. Unlike the swings of glucose highs and lows, ketones deliver a more consistent energy flow. This is one reason some people describe improved clarity or focus during fasting windows. It isn't a universal effect, but for many, this gradual shift away from sugar-dependent swings is what allows the body to feel stable even without food intake every few hours. So why did the constant eating message last so long? Much of it is cultural habit, reinforced over decades. The food industry's promotion of snacks as essential certainly played its part, and early medical advice sometimes blurred together the experience of diabetics on glucose-lowering drugs with that of otherwise healthy people. What endured was a message that missing a meal was inherently harmful, when in many cases it was only those with very specific medical conditions or medication routines who faced such risks. For healthy adults, the evidence does not support the idea that 3 large meals plus constant snacking is the only path to stable energy. At the same time, seniors considering fasting do need individualized guidance. People with diabetes, especially those taking insulin or medications that lower blood sugar, are at risk of hypoglycemia if their medication isn't adjusted. Likewise, those on blood pressure drugs could experience dizziness if blood pressure drops during fasting. This is why every major medical institution stresses that older adults should discuss fasting with their clinician before beginning. The right structure, length of fasts, frequency, and medication balance can make the difference between experiencing benefits and encountering preventable problems. When applied properly, fasting provides older adults with a way to access their stored energy instead of being dependent on constant refueling. That changes how they experience daily life. Activities that once felt draining can feel manageable. Stretches between meals no longer bring on panic, and reliance on sugary snacks for energy fades. These adjustments don't just improve numbers on a chart, they directly shape quality of life. Seniors often describe walking more freely, thinking more clearly, and feeling lighter in their routines. And this adjustment sets up another important benefit. When energy steadies, people begin to notice how their bodies handle movement and recovery differently. Less strain on the digestive system, fewer big swings of glucose and insulin, and steadier blood flow all contribute to a body that is more comfortable to use day by day. That comfort influences mobility, endurance, and how easily seniors keep up with routines without relying on stimulants or snacks. In that sense, the real myth isn't only about weakness after skipping a meal. It's about underestimating how adaptable the body remains, even as it ages. Fasting is not about depriving the body of what it needs. It's about creating space for systems to reset, stabilize, and draw on reserves meant for exactly these intervals. For seniors willing to approach it safely, this shift can be a turning point in breaking free of the cycle of constant eating and the energy fatigue it brings. The larger question then becomes what happens beyond energy and stability, when fasting interrupts not only calorie intake, but also some of the metabolic strain of constant food processing. It introduces changes in inflammation and recovery. And it is here where the body's aches, stiffness, and slowing movements intersect with how it manages inflammation, that some of the most pressing challenges of aging begin to look different. Mobility, energy, and joint relief. Mobility, energy, and relief from joint discomfort form a large part of how older adults experience daily life. Many seniors describe the feeling of slowing down as if it's an unavoidable part of getting older, but much of that decline is fueled by chronic inflammation rather than age alone. It's not just birthdays that make knees ache or stiff backs resist movement. Years of low-level inflammation accumulate until they begin to interfere with everyday function. Once stiffness settles into joints and tissues, once easy activities such as climbing stairs or bending in the garden begin to feel like burdens, what makes this decline so frustrating is not only the physical discomfort, but also the shrinking of life's activities as people gradually give them up. It's easy to mistake this loss for just aging, but clinical and preclinical studies have reported that fasting lowers certain inflammatory signals in the body, and this reduction has been linked to improvements in joint symptoms for some participants. The changes don't appear for everyone or on the same timeline, but when progress does come, seniors often notice that stiffness fades, walking feels easier, and joints become less demanding. Instead of inflammation pushing against movement, the body begins to feel more cooperative. It's not a miracle, responses vary, but it is a biological shift that can emerge when digestion rests, immune signaling cools, and tissues have more resources for repair. Without an intervention, the sequence usually follows a predictable loop. Pain makes movement unpleasant, so activity declines. Less movement weakens the muscles that support joints, which raises pain levels further. The cycle reinforces itself until everyday mobility becomes a constant struggle. What surprises many seniors is that fasting can interrupt this loop. By lowering the inflammatory drive, pain begins to loosen its grip. With less stiffness, walking resumes, strength builds back up, and the cycle shifts in the opposite direction, from decline back toward recovery. Energy is another piece of this story. Chronic inflammation doesn't just burden joints. It undermines muscle performance and drags down overall stamina. Seniors who take up fasting under supervision often describe a shift in how their body uses fuel. As insulin drops and stored fat contributes more energy, tissues run more efficiently. That steadier supply bypasses the familiar pattern of sugar highs followed by energy crashes. When mobility improves alongside this steadier energy, the result is a body that not only moves with less restriction, but also has more capacity to sustain that movement. A clear example is walking. For someone with inflamed joints, even a short stroll can bring dread because of anticipated pain. But when fasting is practiced consistently, inflammatory messengers such as cytokines are reduced and pain signals calm. Walking becomes less punishing, which encourages longer distances. More movement strengthens the very muscles and ligaments that help stabilize joints, further easing pressure and expanding capability. The benefit compounds. What begins with reduced pain extends into long-term improvements in mobility. Gardening offers a similar illustration. Many seniors treasure it for both exercise and enjoyment, but abandon it once joint discomfort makes bending and gripping too difficult. By reducing swelling and stiffness, Fasting can give back flexibility in the hands, hips, and knees. For some, that translates into reclaiming afternoons among plants that they once thought were gone for good. These changes don't erase decades, but they restore functions that bring tangible satisfaction. Family life reflects this shift too. Activities with grandchildren often require kneeling, lifting, or playing outside. For seniors confined by pain, these joyful moments can feel off-limits. When energy steadies and inflammation eases, those barriers fall. Stories frequently emerge of grandparents surprising both themselves and their families with how much they can suddenly manage, whether it's pushing a swing set or joining a walk in the park. These regained abilities carry enormous emotional weight, reinforcing not just mobility but also identity. Both intermittent fasting and longer, supervised fasts have shown effect in reducing markers of inflammation. The pace and depth of results vary. Intermittent fasting, where eating is limited to part of the day, often brings gradual joint relief over weeks as inflammation falls steadily. Longer water-only fasting, carried out in clinical settings, has produced more rapid and pronounced results for certain patients. The difference lies in intensity and supervision, but in both approaches the trend runs the same direction, away from an inflamed environment and toward restored ease of movement. Skeptics are right to point out that weight loss also eases joint stress, and it certainly does. Yet studies have shown fasting's benefits extend beyond the scale. Blood tests reveal reductions in inflammatory proteins independent of weight changes. This means a person may not drop many pounds, but still notice their joints loosening. Relief isn't only about less force pressing on knees or hips, it's also about calmer chemical signaling inside the tissue itself. A mental dimension blends into these changes. Living with pain is draining not only on the body but on the mind. The constant effort of coping erodes motivation, which accelerates decline. When fasting reduces discomfort, the reservoir of energy available to mood and focus often rises. Seniors describe feeling brighter, lighter, and more ready to try activities again. What begins as a physiological improvement becomes a psychological reawakening. The desire to rejoin life returns along with the physical means to do so. Of course, fasting is not a guaranteed replacement for medical care. Severe or advanced joint conditions, such as end-stage osteoarthritis, often still require direct treatments, targeted therapies, or even surgical intervention. Fasting can reduce symptoms and support better function, but it isn't a cure-all or an alternative where medical procedures are necessary. This is why ongoing guidance from a healthcare provider is crucial, especially for seniors whose conditions involve more than low-grade inflammation. For those looking to apply fasting safely, pairing it with light daily activity and sufficient protein intake is a practical step. Gentle walks after meals, resistance exercises with bands or light weights, and attention to protein at meal times help preserve muscle during fasting routines. This combination maximizes the gains in mobility while protecting strength, which is key for joints that depend on surrounding muscle to operate fluidly. Done together, fasting and movement form a loop that restores rather than erodes function. What stands out is that fasting doesn't just mask symptoms with short-term fixes. A painkiller can make a stiff joint feel less raw for a few hours, but leaves inflammation intact. Fasting recalibrates the internal environment so that the signals causing pain are reduced at the source. A hand gripping without strain, a knee bending without resistance, or a back able to rise from a chair more easily are not illusions. They are concrete signs that body systems are functioning differently. Mobility regained in this way carries an added weight because it represents freedom. Walking without hesitation, gardening without grimacing, and joining family without worry all shift the daily experience of aging. Seniors frequently note the satisfaction of regaining roles and activities they assumed were gone. Independence, once narrowed by pain, opens back up. Fasting, by calming inflammation and steadying fuel supplies, provides the conditions for these changes to happen naturally. This physical renewal also sets the stage for another area where aging often steals the most cherished qualities, the sharpness of the mind. Many older adults accept physical slowdowns, but fear cognitive decline far more, worrying that memory and focus will slip away in ways movement never could. Cognitive clarity and brain health. Cognitive clarity and brain health have become pivotal concerns for older adults today, with growing research attention on how fasting might influence both. Rates of memory challenges and neurodegenerative conditions are rising steadily, and families now see mental sharpness as one of the most valued measures of aging well. Even subtle slips, forgetting a name mid-conversation or losing track of daily tasks, can weigh heavily, but the encouraging reality is that the brain is far more adaptable than once assumed, and fasting may create conditions that support this resilience. One of the central discoveries in neuroscience is the role of brain-derived neurotrophic factor, or BDNF. This protein acts like a maintenance and growth signal for the brain. It strengthens connections between neurons, protects existing cells from stress, and improves the ability to form and retain new memories. Normally, BDNF levels decline with aging, which can slow learning and recall. Evidence shows fasting can stimulate higher levels of BDNF. Preclinical and some human studies connect fasting with increased BDNF and improved cognitive markers, though it's important to note that large randomized clinical trials in seniors remain limited. Still, this evidence suggests fasting may help the brain shift into a protective and adaptive state rather than a purely declining one. This shift becomes tangible in daily life. Many older adults describe recurring mental fog, moments where focus is elusive or quick thinking feels harder to access. The assumption tends to be that this fog is simply part of aging, yet fasting hints at a different outcome. By stimulating BDNF and reshaping how neurons process energy, it counters the idea that decline is inevitable. The brain, given the right triggers, can adapt and strengthen. Fuel plays a central role here. Most brains rely predominantly on glucose from food, but for many seniors, especially those with insulin resistance, glucose supply to neurons can fluctuate, creating dips in clarity and attention. Once fasting extends long enough to produce ketones from stored fat, the brain gains a steadier fuel. Ketones provide a stable brain energy source and can reduce glucose swings that impair cognition. A simple phrase to capture this is, fasting helps the brain run on cleaner fuel, not less fuel. This line is easy to remember and explain to family members who wonder why pausing meals might actually support sharper thinking. Along with this cleaner energy, fasting reduces oxidative stress, a process where overproduction of free radicals damages cells. Because the brain consumes large amounts of oxygen and energy, it's especially vulnerable to oxidative damage, which can accelerate neurodegeneration. By moderating these stress signals and pairing them with ketone fuel and higher BDNF levels, fasting sets conditions that both shield neurons and encourage stronger connections. The outcome is not guaranteed reversal of decline, but rather a measurable chance to slow or soften the changes many fear most. The practical effects can be meaningful. An older adult might notice that recalling names or finishing sentences becomes easier. Daily routines run more smoothly without the same mental drag. A retired teacher, for example, who used to stumble over examples that once came fluently, might find herself regaining the quickness that defined her classroom presence. Family members often comment that conversations feel more natural and spontaneous again. Though fasting cannot undo decades of aging, the cleaner fuel and increased protective proteins create an environment where sharpness has more room to reemerge. Some report even more surprising benefits. Seniors accustomed to leaning on children or spouses for reminders sometimes find themselves providing the reminders instead. Household tasks, light planning, and quick calculations feel easier. Conversations require less deliberate effort, and details come to mind more quickly. Each small improvement reduces the weight of worry that often comes with aging, reinforcing both confidence and presence. At the same time, it's critical to avoid overstating this picture. Fasting does not cure dementia or erase the underlying pathology of diseases like Alzheimer's. Researchers emphasize that neurodegenerative conditions involve multiple factors, from genetics to vascular health. Fasting should be understood instead as a tool, one that may lower certain risk factors, improve resilience, and slow the trajectory of decline when paired with other healthful behaviors. In other words, fasting may help maintain clarity and protect brain capacity, but it is not a medical cure for neurodegenerative disease. The mental health effects of fasting extend beyond biology. When seniors experience lapses, fear often compounds the problem. People start to withdraw, avoid conversations, or hesitate to make decisions out of self-consciousness. Even modest clarity improvements from fasting can counteract this retreat. When confidence returns, independence is preserved. Seniors reassert their roles in conversations and family life, and the psychological effect builds alongside the physiological one. Families who witness these changes describe shifts in dynamics. Instead of bracing for continued decline, they see signs of renewal. A grandparent may once again tell stories with timing or recall small details in family history. Shared laughter over wordplay or discussion about current events feels more engaging. These are not sudden transformations, but steady improvements that make day-to-day experiences richer. The real value lies in extending the period of functional clarity and presence. One often overlooked factor is sleep. Poor sleep quality is common in older age and intensifies memory challenges. Early reports suggest that fasting helps regulate hormones linked to sleep cycles, leading to deeper, more consistent rest. Restorative sleep enhances the brain's capacity to consolidate memory and repair itself overnight, significantly reinforcing fasting's direct benefits on cognitive clarity. Seniors who reconnect with better sleep often see their days improve further, creating a reinforcing cycle. While these outcomes are promising, the key is to make them personal and measurable. For seniors trying fasting under safe guidance, it may help to track one manageable sign of clarity over a short period, perhaps rating focus each morning, noticing whether tasks like bill paying or organizing the kitchen feel easier, or journaling about daily recall. Watching these patterns encourages engagement and makes subtle benefits more visible. Of course, any such experiment should be paired with consultation from a clinician, especially for those managing complex conditions or medications. What matters most is recognizing that the brain remains capable of change. Fasting provides an opportunity for older adults to nurture resilience, sharpen daily functioning, and participate more fully in family and community life. These gains may be incremental, but for many, they mean the difference between feeling sidelined and feeling involved. The evidence to date points toward fasting as a practical support for brain health, encouraging but still preliminary in some respects. It emphasizes prevention and resilience rather than a cure. For families and seniors, hearing that improvement is biologically possible can itself be liberating, replacing resignation with careful curiosity. As with every benefit of fasting discussed so far, the next step is to consider safety. Whenever fasting for seniors comes up, the immediate reaction from many people is concern. Questions about whether it is dangerous at this stage of life are common, and those concerns deserve a careful response. The safety question: but isn't fasting risky once you reach your 70s? This is often the first thought people have when considering older adults and fasting. The hesitation is understandable. Aging bodies manage recovery differently, medications build up, and missing meals may appear careless. Yet the real safety issue isn't fasting in itself. It's attempting it without proper structure, especially when drugs that affect blood pressure, blood sugar, or clotting are involved. Those medications can amplify risks if the fasting process is not monitored and doses are not adjusted. Safe fasting for seniors depends entirely on context, preparation, and medical oversight. Unsupervised fasting while taking certain prescriptions is where the danger lies. Blood pressure medications, when combined with reduced food intake, may drive blood pressure too low, causing dizziness or falls. Insulin or drugs that stimulate insulin can push blood sugar levels dangerously low if meals are skipped without adjustments. Anticoagulants, often prescribed to prevent clots, may also behave unpredictably when combined with sudden changes in diet or hydration. These are not theoretical risks. They are well-documented reasons why professionals stress that fasting seniors must coordinate with clinicians. Clarifying this point is essential. The risk isn't fasting itself, but fasting without aligning the regimen to existing medications. When medical teams are involved, results show fasting can be carried out safely well into older age. Clinicians structure the process around three main factors: ensuring hydration, protecting mineral balance, and managing a gradual return to food after any fast longer than a day. Programs that watch over older adults emphasize frequent monitoring, measured refeeding, and clear safety boundaries. In these conditions, seniors have fasted with fewer complications than many experience from mixing multiple prescriptions on their own without oversight. Safety works when strategy replaces guesswork. A useful way to think about this is as a checklist, 3 questions seniors should always bring to their doctor before beginning. First, what is my medication plan? And how will doses change if I try fasting? Second, how will hydration and electrolytes be managed to avoid dizziness or strain on organs? Third, who will monitor me if I attempt anything longer than daily intermittent fasting? Having answers to those 3 questions builds a foundation where fasting shifts from a fear-inducing concept into a structured intervention. Supervised fasting clinics consistently highlight that seniors do not respond with more complications than other groups when these safety conditions are met. In fact, older participants often prove more reliable in following the rules. When told to monitor blood pressure at given intervals or to drink a specific amount of water, seniors tend to comply closely, while younger participants may be more casual. Attentiveness becomes an advantage, adding a layer of protection. This discipline underscores why age by itself does not define risk. The question of frailty also surfaces. Critics often picture fasting pushing a frail person over the edge into collapse. In reality, frailty often stems from chronic inflammation, poor metabolism, and the side effects of long medication use. These same problems are precisely the ones fasting can help address under careful oversight. Seniors who practice structured fasting frequently regain strength and steadiness. They often describe feeling more stable, not weaker, as stiffness and fatigue lessen. The image of fragility fades when the process is matched to the body's needs. It also helps to separate the different types of fasting protocols in order to set safety boundaries clearly. Intermittent fasting, which usually means narrowing the eating window to 12 to 16 hours, is a strategy many seniors can safely explore at home with initial guidance. It gently introduces the body to longer gaps without food while maintaining daily meals. Short fasts lasting 24 to 48 hours are considered safe only if the individual has shown stability with intermittent fasting and has medical input. Extended water-only fasts that stretch beyond a couple of days are in a different category altogether. These should always take place in supervised environments, not private kitchens. Attempting multi-day water fasting at home without a clinical plan is strongly discouraged, particularly for older adults. This distinction ensures that safety conversations remain grounded in practical boundaries. Hydration deserves special caution. With age, thirst responses dull, meaning many older adults underestimate how much fluid they need. Even a mild level of dehydration can create weakness, headaches, or confusion that mimic adverse reactions. Clinicians resolve this by educating seniors to drink regularly and by checking mineral status when necessary. Electrolytes play a similar role. Many medications already disturb sodium, potassium, or magnesium levels. During fasting, imbalances may become more pronounced without oversight. Supervised monitoring keeps these risks manageable. Equally important is refeeding after longer fasts. Digestion must transition carefully to prevent discomfort or complications. Clinicians often recommend beginning with light, simple foods such as fresh fruit slices or vegetable broth, and only adding heavier meals gradually. This gentle reintroduction gives the digestive system time to reactivate without stress. Seniors who skip this step and jump back into heavy meals risk bloating, cramps, or more serious issues. Controlled refeeding is part of what makes therapeutic fasting a structured medical process, not just meal skipping. Family reactions often highlight how sensitive the topic is. Concerns from loved ones usually outweigh what the senior feels during the fast. Relatives may picture dramatic outcomes from missed meals, especially if they see fasting as deprivation rather than a shift in fuel supply. The reality with monitoring tends to be far calmer. Many report that while their family worried, their own experience was steady and uneventful. A single line from one older participant summed it up: "My daughter worried more about my empty plate than I did." That type of concern is understandable, but rarely matches the actual safety profile under clinical guidance. Returning to the core concern, the question is whether fasting is an unnecessary gamble in older age or a manageable intervention. The evidence supports the latter. When checks are in place, fasting becomes a predictable, structured process, not a roll of the dice. It promotes reductions in blood pressure, moderates glucose levels, and lowers inflammatory markers in ways that lighten rather than increase the body's burden. In practice, it can be safer than continued reliance on expanding drug regimens that bring their own cascade of risks. This shift in perspective highlights an important contrast. Many assume that prescriptions are inherently safe simply because they are routine. Yet drug interactions are among the leading reasons older adults end up in emergency rooms. Fasting, under structure, and oversight does not add to those interactions. It reduces chemical load, lightens stress on the body, and supports recovery pathways. Risks remain, but they are identified, explained, and controlled through supervision. Taking no action also carries hazards. Rising inflammation, worsening metabolism, and growing medication dependence all create significant threats to quality of life. Viewed this way, fasting is not a reckless step, but a deliberate method of reducing larger health risks. For seniors aiming to preserve independence, the safer choice may often be a managed fasting regimen instead of more medications layered onto the pile. Safety, then, is about designing the conditions for fasting to work as intended, with a clinician adjusting medication, a hydration and electrolyte plan in place, and clear oversight for anything beyond daily fasting windows. Seniors can pursue the benefits while minimizing risks. The process should never be improvised, but when carried out with structure, it changes from a fearful concept into a well-validated tool for better aging. Understanding safety opens the door to the next challenge: how exactly fasting should be approached by older adults in practice. There isn't one model that applies equally to everyone, and tailoring the protocol makes all the difference in whether results last or fall short. Modern fasting protocols for seniors have been shaped by one central reality: older adults manage unique health situations that younger people rarely face. Metabolism, medications, and the body's recovery systems all interact differently after age 60 or 70. A younger person may experiment with skipping meals randomly or jumping into long stretches without food. But for seniors, that kind of abrupt approach can create unnecessary stress or risk. The goal isn't to endure extremes. It's to build a method that works with the body's current condition, adding structure and safety. What has emerged are 3 distinct approaches that fit together: daily intermittent fasting, occasional short fasts, and professionally supervised extended fasts. Each one serves a different role in supporting health outcomes as people age. For anyone just beginning, daily intermittent fasting is the lowest barrier to entry. It simply means shortening the eating window to give the digestive system longer periods of rest. One research-aligned way to test tolerance is through a progression over the first month. In weeks 1 and 2, a 12-hour overnight fast, say dinner at 7 p.m. and breakfast at 7 a.m., sets the foundation. For many, this requires little adjustment since it relies mostly on sleep hours. In weeks 3 and 4, the window can shift toward a 14-10 rhythm, perhaps having dinner at 7 p.m. and delaying breakfast until 9 a.m. Once this feels comfortable, selected days may extend into a 16-8 split, such as dinner at 6 p.m. and the next meal at 10 a.m. This is not a fixed prescription, but rather a progression seniors can discuss with their doctor. The strength of this structure lies in how it eases the transition, minimal disruption, clear checkpoints, and flexibility to stop or adjust if responses feel off. Even in these early stages, many seniors report feeling more rested in the morning, less dependent on snacking through the day, and more aware of steady energy levels. Hormonal regulation begins to settle, especially around insulin, helping to avoid the sharp spikes and crashes that leave many older adults fatigued. Early changes often include better sleep, calmer digestion, and improved appetite control. While modest compared to longer fasts, daily intermittent fasting builds confidence and metabolic flexibility without forcing sudden leaps outside routine. Once intermittent fasting feels steady, some seniors explore periodic short fasts ranging from 24 to 48 hours. These create more noticeable metabolic effects and allow the body to shift fully from stored glycogen to fat as its energy source. In simple terms, longer fasts switch the body to burn fat and produce ketones, an efficient, steady fuel for the brain and muscles. Many participants describe this experience as mental clarity paired with even energy. Added to that, autophagy, the body's housekeeping process that breaks down old and damaged cells, ramps up more strongly during these longer breaks. Older adults sometimes notice less joint stiffness, clearer thinking, or lighter digestion after short fasts. Still, it's critical to highlight the safety boundaries. Periodic 24 to 48-hour fasts can provide benefits, but frail or multi-medicated seniors should only attempt them after confirming tolerance with shorter fasting windows and always under medical advice. Skipping this step risks interaction problems with blood pressure medications, insulin treatments, or anticoagulants. With professional guidance, however, short fasts can be powerful interventions to reduce inflammation, improve sensitivity to insulin, and recalibrate appetite rhythms. They are best viewed as an occasional reset, generally once a month or a few times a year, not as a frequent routine. The third tier, supervised extended water fasts, exists in an entirely different category. These programs last anywhere from several days to a few weeks and are carried out in clinical settings with professional oversight. The intent isn't simple weight loss. It's therapeutic intervention for chronic conditions that haven't responded to other treatments. Some clinics report rapid improvements in seniors with long-standing hypertension, insulin resistance, or inflammatory disorders who undergo extended fasts under medical supervision. Physicians track blood markers, regulate hydration, and adjust medications to ensure stability throughout. Without close supervision, it can be unsafe, as electrolyte changes, low blood sugar, or drug interactions may occur. But within structured medical programs, Extended fasts have provided relief in cases where standard pharmacological approaches fell short. Understanding how these three layers differ is important. Intermittent fasting is the daily habit builder, the part that can become a sustainable lifestyle. Short fasts serve as occasional deep resets, activating more intensive repair systems that go beyond daily balance. Extended fasts function like a targeted therapy, introduced only for specific medical needs and never without monitoring. Each tier provides seniors with options rather than a single path, and the effectiveness comes from placing the right tool at the right stage of health. To see how this scales in daily life, consider a simple starting scenario. A senior who has always eaten breakfast at 7 a.m. and dinner at 7 p.m. decides to try a 12-hour overnight fast. The first 2 weeks require no more than consistency. Sleep quality improves slightly, and breakfast feels more satisfying after a longer pause. In week 3, breakfast shifts to 9 a.m., creating a 14-hour window. The change is manageable, and by late morning, hunger feels stable rather than urgent. In week 5, they introduce a 16-hour window twice per week, perhaps eating dinner at 6 and the next meal at 10. The surprise comes when these mornings feel noticeably focused rather than weak. Over time, digestion becomes calmer, energy steadies, and medication discussions with their doctor begin to focus on whether doses can be reevaluated. This kind of calculated, stepwise process is how fasting builds confidence rather than anxiety. Critics sometimes present fasting as an all-or-nothing act, a portrayal where one either eats 3 meals a day or plunges into several days without food. The modern model for seniors demonstrates the opposite. Fasting functions on a spectrum. Each point on that spectrum has a place, from daily practice to periodic resets to rare, intensive therapy. This graded structure matters because it makes fasting adaptable. Seniors don't have to choose extremes. They can establish comfort with daily intermittent patterns, explore short fasts where appropriate, and only consider supervised extended protocols when medical conditions warrant. The broader principle here is not about which single approach is best, but about keeping fasting aligned with health status. For some, intermittent fasting will be enough to improve energy, lighten digestive strain, and stabilize blood pressure. For others, occasional short fasts may provide additional benefit in managing inflammation or chronic symptoms. Only a smaller group will be candidates for supervised extended fasts, and those should always occur in dedicated medical contexts. What unites these different approaches is their role in helping older adults reduce dependence on medications, stabilize biological rhythms, and extend functional independence. Perhaps most importantly, seniors don't need to pursue fasting as a rigid identity or a competitive act. Practicality defines success here. Finishing dinner earlier, easing into later breakfasts, or planning the occasional longer pause under advice. Safety does not mean stagnation. Progress can still unfold, but it does so in layers matched to individual tolerance. This approach frames fasting as an adaptable system rather than an extreme challenge. While longevity is often the headline people think of with fasting, its true contribution for older adults runs deeper. The most meaningful gains come not just from adding years, but from improving what those years actually feel like. And that opens to the larger question of how health in later life should be measured. Longevity versus health span. When seniors and families talk about aging well, the terms longevity and health span often blend together, but they point to very different realities. Longevity is straightforward, the total number of years lived. Health span is more specific. It refers to the number of those years spent with strength, independence, mobility, and mental clarity intact. A person may live well into their 90s, but if their last decade is marked by limited movement, heavy medication dependence, and cognitive decline, the years are long but not lived fully. This is where fasting becomes important. Animal studies and some human trials suggest that fasting and intermittent fasting can improve markers linked to aging and health span. They show lower inflammation, enhanced metabolic flexibility, and improvements in resilience. However, definitive proof that fasting extends lifespan in humans simply does not exist yet. What the existing evidence does support is that fasting can improve the practical years of health, adding quality to life rather than only counting birthdays. One of the clearest observations in 2025 comes from data on frailty. Frailty describes a group of risks, weakness, reduced mobility, weight loss, poor endurance that raise the chance of falls, hospitalization, and dependency. In certain studies of older adults who use structured fasting routines, these frailty scores decrease. That change translates into fewer trips to emergency care and a higher likelihood of maintaining self-sufficiency. Fasting studies report improvements in frailty measures and reduced hospitalization in some older cohorts. These are practical markers of health span that matter much more to daily life than abstract longevity. Numbers. This raises the essential distinction. Longevity adds more days to a calendar. Health span ensures those days are usable. Extra time confined to a chair or a hospital ward is very different from extra time spent walking unaided, engaging with family, or managing life independently. Fasting, by stimulating cellular recycling processes like autophagy and moderating chronic inflammation, increases the odds of extending the functional portion of life. Autophagy helps cells clear out damage that accumulates with age, broken proteins, impaired mitochondria, and other cellular debris that otherwise fuel decline. Repair processes like these are what allow muscles, vessels, and nerves to operate more reliably in older age. Instead of focusing only on survival, fasting supports the capacity to live well. It's important to be clear, not every older adult who fasts will experience dramatic physical renewal. Many seniors report improvements in mobility, steadier energy, or clearer thinking, but responses vary depending on health history and medications. For scientists and clinicians, metrics like fewer hospital visits, lower frailty scores, and reduced drug dependence are far stronger indicators than any single anecdote of dramatic recovery. These objective improvements matter because they affect how older adults experience daily life with less disruption and greater autonomy. The biology at play helps explain why health span benefits show up in practice, even when exact effects on lifespan remain uncertain. Constant eating and reliance on medication often accelerate inflammation, oxidative damage, and metabolic wear. Fasting interrupts this cycle by giving the body extended breaks from processing food, lowering harmful signaling, and turning on pathways associated with repair. These internal shifts don't add visible years to the calendar, but help keep those years livable. Seniors who can continue walking comfortably, caring for themselves, and participating actively in their communities reflect this outcome. Hospitalization is a useful example. For older adults, hospital stays often trigger a spiral. Time away from activity leads to rapid muscle loss, which raises fall risk, sometimes permanently. Preventing the initial decline means preventing the spiral. By moderating frailty risk and lowering inflammation, fasting reduces the likelihood of hospital admission in the first place. It's not only about improved numbers on a lab test, but fewer disruptions that steal independence. That is health span in measurable terms. From an individual perspective, the change is often felt in simple ways. Some seniors notice it in easier mornings, where energy rises without heavy reliance on stimulants or constant snacks. Others recognize it in steadier balance, enabling them to move more freely around the home or outdoors. Family members may see it when their loved one participates more actively at gatherings, less burdened by fatigue or discomfort. These outcomes don't promise an escape from aging. They represent the extension of functional life in ways that sustain everyday dignity. It also reframes how we measure progress. Modern medicine has proven effective at extending longevity with treatments and drugs, yet those interventions often lead to years bound up in complex regimens or assisted care. Fasting points instead toward increasing the portion of life that remains lived with competence and independence. It does not replace medications when they are absolutely needed, but it can reduce an older adult's dependency on them by addressing some underlying dysfunctions. That shift from managed decline to active maintenance defines the value of health span. Research reviews consistently emphasize the limits of current evidence. We know fasting can reduce frailty and improve markers like insulin sensitivity, blood pressure, and inflammatory load. Preclinical studies add encouraging signs that it may slow or soften some changes seen in aging tissues. But long-term, randomized human trials that conclusively link fasting to lifespan extension in older populations are not yet available. What is demonstrated today is not a human cure for aging, but a practical tool that supports resilience, reduces dependency, and opens more space for independence in later life. The longevity versus health span distinction therefore becomes a choice in emphasis. It's the difference between aiming for more years and aiming for more usable years. For seniors, the latter often proves more meaningful. 10 extra years attached to medication, frailty, and hospital visits limit quality of life. 10 extra years walking, reading, and engaging with family change how life feels on a daily basis. Fasting may not add decades of lifespan, but it positions more of the years someone already has to be lived with strength and clarity. Equally important is how families interpret this distinction. Loved ones may encourage older adults to prioritize eating to maintain strength, equating food volume with vitality. What fasting research shows instead is that carefully planned meal timing and periods of rest can create conditions where health span extends. Independence, clarity, and mobility are preserved not by constant intake, but by balanced cycles of nourishment and repair. For families, this reframes the conversation from fear of deprivation to recognition of strategic recovery. Ultimately, the real measure of aging well is not counted in the candles on a cake, but in the days lived without constant dependency. Seniors who fast under guidance are not guaranteed longer lives, but many gain the practical advantage of living their present years more fully. That shift from simply surviving to sustaining independence underscores why health span often matters more in real life than raw lifespan totals. As encouraging as these outcomes can be, skepticism does not vanish overnight. Many seniors still face doubts the moment they mention trying fasting within their circles. Some of the strongest pushback comes not from doctors or researchers, but from the people closest to them, whose instincts about aging and food were shaped by decades of cultural messages, social myths, and family pushback. "Grandma, you'll faint if you don't eat." That kind of reaction is common when an older adult mentions trying fasting, and the pushback usually comes from family. The concern is genuine. Nobody wants to see a loved one become weak, but the fear often comes from assumptions rather than current evidence. Food has long carried symbolic meaning in family life. A full plate signals care, and offering more food can feel like offering love. In that context, choosing not to eat is misinterpreted as refusal or even neglect. Food is love in many families. Explaining that fasting is structured and health-focused, rather than rejection, helps ease anxiety. That short shift in framing can turn a difficult conversation into one of understanding. One practical way seniors can reduce pushback is by offering a plain, simple explanation of what fasting does in the body. Instead of giving technical lectures, a calm summary helps. Fasting lowers inflammation, steadies blood sugar, and gives the body time to restore itself. Framed this way, it's no longer about skipping a meal. It's about creating a health routine supported by evidence. Families don't always need to know every detail of autophagy or ketone production, but hearing that fasting is structured, safe when supervised, and practiced in clinical programs around the world goes a long way toward breaking fear. A second step involves inviting family into the process through discussion with a physician. Seniors who tell relatives, "I've spoken with my doctor, and we've set a plan together," shift the conversation from opinion into medically guided action. If family members still doubt, including them in a doctor's visit or video call allows concerns to be voiced and answered by a professional. This reassures relatives that fasting isn't reckless, it's anchored in medical oversight. Many clinical programs report strong adherence among seniors precisely because they follow protocols closely. Far from being fragile or forgetful, older participants often demonstrate more discipline than younger ones, checking blood pressure, staying hydrated, and complying with safety steps. This observation contradicts the idea that fasting is too complex or risky for seniors. Families tend to trust results more than explanations. Visible progress changes conversations. The parent who used to nap after every meal but now has steadier energy shows the difference directly. The grandparent who once struggled up the stairs but now moves more confidently is a living counterargument to the worry about skipped meals. When family members notice that fasting strengthens resilience rather than draining it, the pushback starts to soften. At some point, relatives stop asking if grandma is eating enough and start asking how she managed to feel younger than she did last year. Still, social pressure does not vanish overnight. At gatherings, seniors may face the old expectation that refusing food is impolite. Well-meaning relatives might encourage, "Just one more plate, you need to keep your strength up." A polite but prepared response can ease this moment. Something as simple as, "I'm eating on a different schedule now, but I'd love to spend time with you," keeps the focus on connection, not conflict. This explanation, repeated consistently, reframes fasting as another form of self-care instead of a rejection of tradition. Once family members see that social warmth remains intact, concern usually fades. Another challenge arises when adult children project their own eating habits onto their parents. Someone who feels irritable when skipping breakfast assumes their parent must feel even worse. But seniors who practice fasting often find their patience and steadiness improve, not decline. Instead of collapsing from hunger, they operate with clearer energy. This contrast forces family members to update outdated assumptions. The real evidence comes not from arguments, but from the parent's resilience, a resilience that widens the family's perspective on what aging can look like. The progression of family response tends to move in stages. First comes fear, an automatic belief that fasting equals harm. Later comes doubt. Relatives realize these fears don't match the senior's actual results. Finally comes recognition. Family members see their loved one functioning better and acknowledge the positive changes. In the best cases, what started as pushback transforms into admiration. Grandchildren who once begged grandma to eat more may later tell friends that she has more energy than their own parents. This shift carries weight because family often defines the boundaries of daily life for older adults. When relatives hover, urging constant eating, worry can turn into limitation. Seniors are told to rest more, to slow down, to eat to keep up strength, messages that may reinforce decline rather than prevent it. But when seniors demonstrate capability through structured fasting, roles change. They move from being seen as dependent to being recognized as leaders in their own health. For families, this can be both reassuring and inspiring, creating space for everyone to reconsider long-held beliefs about aging. For seniors facing strong resistance at home, two strategies make the biggest difference. First, share a short explanation of fasting benefits framed in plain language, how it steadies energy, reduces inflammation, and helps the body function more efficiently. Second, actively involve family members in reviewing a physician-approved plan. These steps don't erase generational fears, but they do create clarity that replaces anxiety with confidence. And a simple viewer call to action can help. If your family worries about fasting, share this video with them or bring a printed safety checklist to your doctor's appointment. These conversations are smoother when everyone sees that fasting can be safe, strategic, and professional. The pushback seniors encounter is rarely about fasting alone. It's about memory, family traditions, old medical advice, and cultural habits tied to food. Yet as soon as fasting is reframed as structured and health-focused, the conversation changes. What begins as resistance often turns into curiosity and eventually into pride. Seniors gain not only confidence in their own routines, but renewed influence within their families by serving as examples of how aging can feel when health span rather than decline is the focus. This family shift is more than symbolic. It sets the stage for exploring what makes sustainable health possible from the inside out. Just as fasting helps the body recalibrate energy, it also introduces changes deeper than most expect, changes influencing how the body processes food, regulates immunity, and even shapes mood. And it begins in a place many people overlook, the community of microbes living in the gut, resetting the body's microbiome. One area where fasting shows an underappreciated effect is gut balance. For older adults, how the intestines function ties directly into energy, mood, and immunity. The mix of bacteria inside influences signals sent to the brain, regulation of inflammation, and even how the immune system responds. When that balance tips, the result is more than simple stomach discomfort. It alters how the whole body feels. Short-term fasting and fasting-mimicking diets have been shown in experimental and some clinical settings to reduce less helpful bacterial species while allowing beneficial strains to rebound once feeding resumes. Responses do vary, and the outcome depends heavily on what foods are chosen when eating resumes, but the overall trend suggests fasting provides a valuable pause for rebalancing. Each meal normally feeds bacteria in predictable ways. Fiber and plant compounds encourage the growth of species that produce short-chain fatty acids, key compounds that protect the lining of the gut and regulate inflammation. Highly processed foods or added sugars feed microbes that generate byproducts irritating to the intestinal wall, which propagate discomfort and low-grade systemic inflammation. When meals arrive from morning to night with little rest, unwanted species can dominate. Many seniors feel this directly in the form of bloating, gas, or constipation. These aren't minor digestive issues, but clear signals of disruption in the microbiome. Fasting alters that cycle by withholding constant nourishment from microbes. When food pauses, fast-burning, sugar-dependent bacteria lose ground. The gut quiets, reducing bloating and irritation. This pause provides an opportunity for balance to shift once meals return. What happens afterward largely depends on the diet that breaks the fast. Reintroducing fiber-rich foods tilts metabolism toward resilience. When seniors end fasts with vegetables, legumes, fruits, and some whole grains, microbes that produce protective compounds are given the edge. This reinforces gut lining strength, improves absorption, and reduces the inflammatory signaling often linked with both digestive issues and fatigue. After a fast, reintroduce fiber-rich whole foods slowly, vegetables, legumes, and whole grains in simple cooked forms. This supports healthy bacterial repopulation and reduces digestive upset, a crucial guideline for older adults. The gut's effects ripple widely. Roughly 2/3 of immune activity depends on the microbial community. When disrupted, the immune system can become overactive, triggering unnecessary inflammation, or underactive, leaving seniors more vulnerable to infections. By lowering microbial overgrowth and supporting regrowth of stabilizing species after refeeding, fasting helps the immune system function more consistently. Clinical observations note decreases in inflammatory flares, greater resistance to seasonal illness, and more balanced immune responses among older adults who follow structured fasting regimens. At the same time, it is essential to remember that very long or extreme restriction without guidance can sometimes reduce colonization resistance, making it easier for harmful organisms to take hold. That is why supervision and appropriate refeeding matter. Improvement requires balance rather than extremes. Mental health connections stem from the same source. Nearly all serotonin and significant amounts of dopamine are produced in the gut. When harmful microbes dominate, mood-stabilizing signals don't reach the brain in normal patterns. Anxiety or irritability without clear cause can often result. Seniors frequently describe feeling off, even when everything on the surface looks fine. As the microbiome resets, biochemical signals normalize. The change doesn't appear as euphoria. It shows up as steadier resilience, calmer responses to stress, and more consistency in outlook. What seemed like age-related mood swings are sometimes the consequence of gut imbalance that fasting and structured refeeding can recalibrate. Digestive complaints like constipation and bloating weigh down daily life for many seniors. Medication use, painkillers, antacids, blood pressure drugs often worsens these symptoms. Over time, appetite shrinks, meals lose appeal, and discomfort limits activity. Families may underestimate how much these smaller problems impair confidence and joy. Dietary adjustments can ease symptoms, but fasting intervenes more directly. By halting digestive strain, the gut resets, and upon resuming eating with plant-dense foods, seniors often notice lighter meals, less bloating, and restored energy. This change reaches into activities that support well-being. Someone who avoids walking after meals due to gas or pain finds movement easier, and in turn, activity strengthens gut function further. An older woman, once reluctant to attend social meals due to discomfort, might feel able to join family dinners again. Another senior notices that constipation, a constant stress, begins to ease after several weeks of regular overnight fasts and careful morning meals. These examples illustrate how digestive relief extends into mood, physical mobility, and family involvement. The reinforcing cycles become clear. Calmer digestion supports more activity. More activity supports better gut movement and microbial diversity. Improved bacteria balance lowers inflammation, which steadies energy and mood. Each benefit multiplies the effect of the others, turning a fragile, reactive system into a more resilient, stable one. This also explains why seniors often describe the improvements as broader than a stomach fix. They feel visible differences in energy levels, clarity, and overall well-being. Concerns about nutrient intake remain important. Families hearing that a senior is fasting may worry meals are too few to cover essential needs. Yet, fasting does not mean eating less overall. It means concentrating food into structured windows. With adequate planning, seniors can still meet nutritional requirements while avoiding constant exposure to processed snacks. In fact, choosing whole foods during these meals strengthens the microbiome more effectively. What matters most is not simply pausing food, but choosing supportive foods once eating resumes. Practical guidelines emphasize simplicity. Fast overnight, then reintroduce meals with cooked vegetables, legumes, and fruit portions before heavier foods. Avoid breaking a fast with high sugar or heavily processed items, which feed the very bacterial strains you want to suppress. This sequence allows beneficial species to establish dominance and makes digestion smoother. Seniors who follow this steady process often report fewer issues with bloating or irregularity and greater enjoyment of meals. Immune shifts are equally vital. With a more balanced microbiome, immune responses are less erratic, and seniors experience fewer inflammatory flare-ups or sudden immune lapses. Instead of constant colds or digestive inflammation, the body operates with a calmer baseline. For older adults, This doesn't just mean less discomfort. It reduces risk of hospitalization, since hospital stays often create rapid physical decline due to reduced mobility. Avoiding them preserves independence. Step back, and the picture becomes consistent. Digestive improvements, immune steadiness, and mood stability all connect to microbiome balance. Fasting interrupts old cycles, and refeeding with plant-focused meals establishes healthier ones. The outcome is not guaranteed, and responses vary depending on the individual microbiome and diet, but this strategy offers seniors a practical way to reset a key foundation of their health. By appreciating that the gut communicates broadly with the rest of the body, fasting reveals its role as a whole system intervention rather than just a change in meal timing. Digestion, immunity, and mental resilience link back to the same core ecology. When seniors restore that balance, what once felt like random declines in daily comfort begin to reverse. This pattern reinforces a simple but powerful view. Fasting is not about removing life's pleasures, but creating routines where the body functions more smoothly. And seeing how the gut responds makes clear that the benefits go far beyond better digestion, extending into areas that shape how well and how fully life is lived as the years advance. It is this broader influence that brings us back to the central point of the entire conversation: what fasting really means for older adults seeking to protect their health and sustain independence. Fasting designed for seniors is not about skipping meals. It is about creating conditions where health can improve. When done safely, it can reduce dependence on medications, support clearer thinking, improve mobility, and stabilize energy. Instead of automatically adding more prescriptions, fasting can create metabolic conditions that support repair and reduce symptoms for many older adults under supervision. If you are considering it, always consult your doctor, especially if you take blood pressure drugs, insulin, or other prescriptions. And if this perspective resonates, share it with loved ones and ask your clinician about a supervised plan. If this helped you, leave a comment with your top question about trying fasting at 65 plus. That gives us topics to answer in existing videos or in the community discussion.